Hello friends, welcome to my YouTube channel Dr. Amol Mediclass. I am Dr. Amol Pathak. In last few lectures, video lectures, we were discussing about the clinical examination of motor system, and in that we have discussed about the involuntary movements. We have discussed about different types of involuntary movements. We have discussed about the tremors, epilepsy, seizures, facial tics, etc. Today we will be discussing the last topic from this involuntary movement, and the name of this topic is involuntary movement limited to muscle. We all know till now that in all the other types of involuntary movements, the muscles are invariably affected. In certain involuntary movement, the joints, limbs can also get affected. But this topic that we are going to discuss is exclusive for the muscle only. So there are certain diseases in which only the muscle gets affected and not the joints. So the involuntary movement will be limited to a muscle, to only one muscle. So we are going to discuss such involuntary movements. The commonest example we can say is Clonus or fasciculations, myokimia, etc. So we will be discussing these involuntary movements under this heading. So Clonus is defined as the involuntary, rhythmic, repetitive muscular contractions as well as relaxations occurring in response to a suddenly applied stretch stimulus. But the clonus can also occur without application of the stretch stimulus. It can also occur in certain anxiety states. Now let us discuss the common causes for clonus. Clonus occurs whenever the muscles are hypertonic. So what are the common causes for hypertonia? The common causes for hypertonia are pyramidal tract diseases, hepatic encephalopathy, spinal cord lesions, some anxiety state, and vigorous exercise. So because of these reasons, the muscular tone increases and the muscle can undergo into sudden muscular contractions and relaxations, resulting into clonus. The clonus can be stopped suddenly when the muscle is brought in such a position, or when the limb is brought in such a position that the particular muscle which is in clonus gets relaxed. So by relaxation, the clonus can be stopped. Which are the commonest examples of clonus? Ankle clonus and patellar clonus. In the ankle clonus, the gastrocnemius muscle is affected, whereas in the patellar clonus, the quadricep group of muscles are affected. Now let us discuss another type of involuntary movement limited to the muscle, and that is fasciculations. Fasciculations are also called as muscle twitching. Basically, fasciculations are nothing but the irregular and non-rhythmic contraction of the muscle fascicles. The fasciculations can be fine in nature or they can be coarse in nature, and they are most easily seen in the larger muscles such as the muscles of shoulder girdle like deltoid, or the muscle of leg like calf muscles. Fasciculations are present at rest also, or they can be brought on, or they can be aggravated by any voluntary movement. There are various reasons are present for the fasciculations. Say for example, fasciculations occur in certain motor neuron diseases, in the degeneration of anterior horn cells, or some anxiety state, muscle fatigue. It can also be caused or brought on because of some influence of drugs, alcohol, warming of the muscles, etc. So there are multiple reasons are present for the fasciculation, and the fasciculation is always a choice or a diagnosis of exclusion. Fasciculations, when they are associated with muscular wasting and the exaggerated reflexes, then it indicates a severe underlying motor neuron disease. Sometimes the fasciculations can also be noticed in a patient who is recovering from polio. Now we will discuss last two involuntary movements limited to muscles, and those are myokimia and shivering. Myokimia is the most commonly encountered involuntary movement in day-to-day practice. Myokimia can be fine or coarse. It can be rapid in nature also. If the involuntary movement is fine in nature and is limited to some muscle fiber, say for example, if it is limited to the orbicularis oculi muscle and it is fine in nature, it can be termed as myokimia. Whereas the coarse myokimia is commonly encountered in the larger muscle fibers, say for example in the muscle of thigh region, in the muscles of shoulder region, in the muscles of arm, in the muscles of chest. Occasionally, myokimia can also be noticed in the intercostal muscles. These involuntary movements can last sometimes for few minutes also, and they can be able to move the joint also if the muscle is very close to that of the joint. Myokimia is usually not pathological and it is brought on because of some stress, anxiety, and muscular fatigue. Now let us discuss the last point in the involuntary movements limited to muscle, and that is shivering. Shivering is the rapid and regular involuntary movement affecting the whole muscle occurring in response to cold stimulus or cold application or exposure to cold environment, and it stops by rewarming of the muscle or by application of warm. Shivering can be stopped. So these aggravating and ameliorating factors will differentiate shivering from other types of involuntary movements. Shivering is usually physiological, occurring in response to some environmental stimulus. It can also occur in some diseases like fever, malarial fever, etc. In shivering, the involuntary movement will be limited to the muscle and the joints or the limb will not get affected. Here we finish involuntary movements. In the next we will discuss about reflexes. Thank you.